So on the heart, there's lots of things to look at on the outside especially, but let's start at the beginning. So return venous supply from the lower limbs and trunk, inferior vena cava. On the top side, coming from the head, superior vena cava. Okay. On the outside, kind of the obvious thing is the aorta, the ascending aorta, the arch of the aorta, and it's going to come around and be the descending aorta. You're going to have here some vessels, the brachiocephalic, left common carotid, and left subclavian. This big one here is going to be the pulmonary trunk, which is going to go up into the pulmonary arteries right here. It actually splits about here, goes underneath to the left, to the right side. Just below it right here, these marked in red are incoming from the lungs. Okay, so this is coming from the lungs. These are veins because they're coming into the heart. So going out of the heart is always an artery. Coming into the heart is always a vein. Even though this is oxygenated blood, it's a vein. Even though this one is deoxygenated blood, it's an artery because it's leaving the heart. This is the only exception that I can think of in the body. So here we go. From the outside, these are the auricles. So you're going to have one right here on the left atrium, or right atrium. You're going to have another one here on the left atrium. Outside, we're looking at some arteries. So right here is going to be the interventricular septum. Inside, we'll see that. This is the interventricular artery, the anterior interventricular artery, because on the posterior, there's a posterior interventricular artery also. But so this is the one on the front, anterior interventricular artery. It's coming directly off of the arch of the aorta. So right in here, I don't know if I can take this apart and we can see it. The arch of the aorta, where'd it go? The arch of the aorta has a little opening right here, the coronary artery. So you're going to have a left and a right coronary artery, this being the right one. The left one comes off at about the same place, right at the base of the aorta. And then here's the left right here. So this is the left coronary artery. Left coronary artery is going to become the circumferential artery, which is that one right there going around the circumference of the heart. Right there where it gives off that branch, this one will become the interventricular, anterior interventricular. This is going to go around as the coronary artery and drop some other branches. I'm not going to concern you with that. Okay. The veins, I'm not going to make you learn all the veins. They're basically the return to the heart, except for this big one right here. So the heart itself has its own blood supply. That's what those left and right coronary arteries are doing. Right off of the aorta, left and right coronary are giving blood to the heart. So this is oxygenated blood to the heart. This is the return. This is the great cardiac vein. The great cardiac vein is going to empty into the cardiac sinus. Cardiac sinus is going to empty into the right aorta. Okay, so we're going to go inside and have a look at that. Okay, so as we saw earlier, the superior and inferior vena cava are going to empty into the right aorta. That's going to be this right here. The coronary sinus is going to empty into this same place, okay, into the right aorta. On this side, we're going to have, it doesn't show very well on this model. It shows better on this model. Maybe. That big hole right there in the center is the foramen ovale. So when you're a baby, it's an open hole, it's a foramen, and then that changes names to the fossa ovale. So what we're looking at there, where that flap has sealed over, it's called the fossa ovale. And there's some birth defects where that doesn't always seal, and that provides a leak of blood into the of deoxygenated blood, and you don't want that. Okay, so coming out of the right aorta, you're going to have this valve right here. This is the tricuspid valve because there's 3 cusps. These little wings are called the cusp. There's 3 of them. This is the right atrioventricular valve, or the right tricuspid valve, or just the tricuspid valve. Everybody knows what you're talking about. I'm trying to show these little cords that are connected to it. So these cords are called the chordae tendineae. They're going to hook into these muscles at the bottom, called the papillary muscles. These are the papillary muscles, and this meat kind of looking stuff inside the both ventricles, that's the trabecula carni. I think it's better visualized on this other model. That's what it looks like, trabecula carni. Okay, so in the heart, in general, there's 4 chambers. There's a right and a left aorta. There's a right and a left ventricle. Separating them is this interventricular septum. You see how nice and thick that wall is. That separates left and right. And sometimes there's interventricular defects where there's a hole there, and that also allows for mixing of deoxygenated blood with oxygenated blood, which you don't want. If you look at the wall sizes, look at the thickness of the muscle here on this right ventricle. It's not nearly as thick as the opposite side. The reason being, this left muscle only has to pump up this pulmonary trunk and go to the lungs. There's not a far distance, there's not a lot of pressure. On this side, this is pumping out the aorta to the entire body, so it's a lot more pressure, it needs a lot more muscle. So that's one of the ways you can tell. The valve on this side, on the left side, only has 2 cusps. This is known as the bicuspid valve, or the mitral valve, or the left atrioventricular valve. So they change names a little bit, but kind of the easy way to remember this is, as far as blood flow, it's coming this way, going back, and then coming in to this side. So it's tri before you bi. The tricuspid valve will see blood first, and then it'll come back, go to the lungs, and come back and go through the bicuspid valve. Okay. To get there, it has to go through these little valves that look like little moons. These are the semilunar valves. So the semilunar valves are in this pulmonary trunk. Okay, so these are the pulmonary semilunar valves. And I'm making that distinction because the other one is right there in the aorta, right there. So the aortic semilunar valves are the ones that take you from the left ventricle into the aorta and on their way to the body itself. Okay, there's not a lot to see in the left aorta. It also has the foramen ovale. You can see the remnants of the foramen ovale. Let's see, what else do we need to talk about? So I think it helps a lot just to follow blood through the heart. It's going to come in here. This is deoxygenated blood, goes through the tricuspid valve, goes into the right ventricle. This is going to pump. It's going to go up this pulmonary trunk. It'll go through these semilunar valves, up the trunk, into the pulmonary arteries, left and right, to the lungs. Comes back. Now it's oxygenated blood. These are the pulmonary veins coming in, comes into the left atrium to the left mitral valve, to the left ventricle, through these aortic semilunar valves. It's going to go out here first. The heart's going to give itself blood through the left and right coronary arteries. The rest of it's going to continue up the ascending aorta. Some of it will go up through the brachiocephalic, left common carotid, and left subclavian, but the majority of it is going to come down descending, go down and make some splits into your abdomen, work its way all the way down to your feet.